Hello and namaskar to all of you. Today, I have a question for you. Do you know there are certain diseases which may not be showing any clues of it being present in our body? In other words, the symptoms of that disease may not be apparent to us. Yes, indeed, there are certain diseases that have no symptoms for a long period. It's only later that the symptoms appear and put the individual in great discomfort. They are called asymptomatic. And one would wonder why to approach a doctor if you don't have any symptoms, right? Because of this very reason, they are also named as subclinical. Among such subclinical diseases, one of the most common is subclinical hypothyroidism. Hypothyroidism is understood by many as an underactive thyroid. So, do we need to worry about hypothyroidism? What percentage of the general population are affected by this disease? Some studies have estimated that 3 to 15% of the general population suffers from hypothyroidism. Also, it has been found that the prevalence is more in countries where the iodine consumption in the diet is less than required. Now, as far as India is concerned, according to a nationwide study published in the Indian Journal of Endocrinology and Metabolism, hypothyroidism was found to be highly prevalent amongst the population and rising. Secondly, women were 3 times more likely to be affected by hypothyroidism than men, especially those in the age group of 46 to 54 years. Not only that, they found that almost 1/3 of the hypothyroid patients were not aware of their condition. So we must realize that subclinical hypothyroidism cannot and should not be ignored. Before we go ahead, let's understand what organ are we dealing with. Some of you may know about it. The thyroid gland. It is located in the front side of our neck in the body. Right there. Do not underestimate it because of its size. It's small but very, very crucial. To be more precise, it is situated in front of the trachea, that is the windpipe, and below the voice box, also called as the larynx. In men, it lies just below the Adam's apple. Now let's know its purpose in our body. Thyroid is an endocrine gland. This simply means that it produces chemicals called hormones. These thyroid hormones, among others, are responsible for running our body, like literally. It regulates growing up, breathing, our heart rate, our appetite, sleep pattern, thought pattern, sexual drive, in women menstrual cycle, and the feel good factor. I think you'll agree with me when I say this is the most important function, don't you? Since we will be focusing on 2 hormones that it produces, you must know their names. The first one being triiodothyronine, abbreviated as T3, and second one being thyroxine, abbreviated as T4. Hierarchy exists everywhere, even in our body. Thyroid is itself under the command of another hormone which goes by the name of thyroid stimulating hormone TSH. It is produced by the brain. It monitors the levels of thyroid hormones in the blood through its action on the thyroid gland. Now that we know the function of thyroid in our body, let us find out what happens when its function is reduced or when it becomes underactive. At first, you may barely notice the symptoms. They could be tiredness, fatigue, and weight gain, or you may simply attribute them to getting older. Symptoms of hypothyroidism or underactive thyroid includes tiredness, weight gain, dry skin, hair loss, puffy face and swelling in neck, pain or stiffness or swelling in joints, increased sensitivity to cold, elevated blood cholesterol levels, depression, irregular menses in females, infertility. These symptoms are always confused for other serious health conditions. This is one of the reasons why a lot of thyroid patients remain undetected for a long time until their condition worsens and they eventually approach a doctor. Please note that one may not necessarily experience all these symptoms and at times none at all. Also, the magnitude of these symptoms may vary from person to person. So, as an aware and informed individual, what must you do? You can prevent the impending discomfort to yourself and your near and dear ones. This is possible by early detection and treatment. Screening for subclinical hypothyroidism. Some individuals are at increased risk for developing hypothyroidism sooner or later in life. They include women over age 50 years, having diabetes, with a family history of thyroid disease, having had a thyroid surgery, consuming iodine deficient diet, or in pregnancy. For this very reason, some doctors recommend that women more than 35 years of age should get their thyroid function routinely assessed in an annual health checkup. The screening test to assess the thyroid function is known as Thyroid Function Test, TFT. The hormones assessed in this test are the thyroid hormones T3 and T4 and thyroid stimulating hormone. The variety of results this test produces are as follows. What is to be expected after this test? Where, rather to whom, should you approach with your test results if they do not fall in the normal thyroid functioning category? Doctors who are specialists in this field should be consulted. Many of you may know them as endocrinologists. Now they may ask you to do any one of these. Repeat test after 4 to 6 weeks and report back, or take the medicines prescribed regularly, or both of the above. So what does this mean? Subclinical hypothyroidism is a curable disease. The drug which makes this possible is called levothyroxine. This wonderful little tablet does the trick. It basically replenishes the amount of much needed thyroid hormones in the body. It should be taken according to the dose prescribed to the patient by the doctor. Your endocrinologist will ask you to visit her regularly to make sure the drug dose provided to you is benefiting you or whether it has to be increased or decreased. So we have understood that a certain amount of thyroid hormones must be maintained in the body. This is very crucial for proper functioning of our body. To fulfill the above need, I emphasize that the medicine should be taken regularly. What happens when you take the medicine irregularly or postpone treatment or decline treatment altogether? Subclinical hypothyroidism, when left untreated, progresses to overt or full-blown hypothyroidism. This brings great discomfort to patients in form of symptoms elaborated earlier. This will also distress some treating physicians and definitely family members. Also note, there are some studies which suggest that hypothyroidism puts the individual at great risk for acquiring cardiovascular diseases. This avoidable discomfort questions our knowledge and stamina, and most importantly, our attitude towards our body and maintaining it in a healthy state. Don't you think so? We are in this era of medical advancement where a single blood test can provide so much information about what is going on in the body. This medical advancement is for us. Let's not shy away from it. But yes, it can be baffling when you have to take medicines when you feel nothing wrong with your body. You may not want to take it. But you must realize that medical science is moving towards prevention and early detection of disease. We have a crucial role to play in this. That way, we will make health more meaningful. Let me again recapitulate the two most important key concepts we learned today. The first one being routine assessment of thyroid function, and secondly, early and regular treatment. Thank you guys. I hope you like this video and this proves to be useful to everyone. Also, I want to thank my professor and my friends for helping me out. Always. Yeah, thank you.